folks from different backgrounds and disciplines involved in the study. It was quite a comprehensive project that had 8 major objectives to it, or 7 major objectives to it. We were interested in looking at the prevalence of neurological conditions across the continuum of care, across home care, nursing home, mental health, and other settings. But we're also interested in understanding the clinical characteristics of people with 10 different conditions, and I'll show you a couple of examples of the research that we did in that regard. We were also interested in some issues around the appropriateness or the feasibility of using INTRI solutions to understand the experience of persons with neurological conditions. So we were interested in looking at how well the care planning protocols worked with this population, as well as other applications like outcome measures, risk algorithms for predicting adverse outcomes, and quality indicators. We had a number of substantive studies where we were interested in patterns of use of health and social services, use of treatments like pharmaceutical treatments or access to physical therapy. So there's a series of papers underway related to that. We've done some work also looking at costs of care in nursing home and home care settings. In home care, we're interested both in terms of the formal and the informal costs of care, and that work is closely tied in now with the work of Statistics Canada and Health Canada regarding the simulation model for neurological conditions across the life course. Jillian, I just saw a chat message that some folks think the line is muted. Can you guys hear me okay?